The pain I had received from the effects of radiotherapy, to me, it is just undescribable.
Constant pain, my hands paralysed, my arm moves only with difficulty.
My shoulders gone skinny, front and back, all wasted.
If only I'd known that I was going to end up with a body like I've got now, I wouldn't have had the radiotherapy.
One in 12 British women will get breast cancer. They put their trust in doctors who use radiation machines like this one to give them the best possible form of treatment. But now more than 1,000 women claim that the radiotherapy designed to save them has maimed them. Tonight, we hear their tragic story and ask, could it have been avoided? And to find out what's really going on in this most sensitive area of medicine, we carry out a special big story survey of breast cancer treatment in Britain's 54 radiotherapy centres. In the wake of the campaign just launched by women who've suffered horrific side effects, we discover major differences in the type of care women can expect to get and show how it all depends on where you live.
Would you like an extra on that?
Yes, please, thank you.
Okay.
For most breast cancer patients like Doreen Tully, radiotherapy has no serious side effects.
I had an operation to take away the affected cells, and then I had radiotherapy. I was told there may be some burning and discomfort, and indeed there was, but not to any extent. I do all the things I did before. I still ski and swim, and I walk a lot. In fact, better than before.
Pauline Thomas had radiotherapy. She ended up having her right arm amputated.
I've got this terrible pain in my shoulder, which I discovered was a fractured collarbone. My arm started to deteriorate badly. I used to have to put it in a pocket or hold it. I couldn't just have it hanging there anymore. It was just so painful. Then I started getting ulcers in the lower part of my arm, which were very painful, having them dressed every day. And then one day, my arm completely went dead. You just don't believe how much you take for granted 2 arms when you end up with just one. But the pain doesn't stop there. You still have phantom pains. Your arm and your fingers and that are still there, even though they're not there. I think, knowing what's happened to me now, if I'd have known that that was going to happen to me, I think I might have thought about a different type of treatment.
This woman is about to have a routine operation for the removal of a lump from her
No
breast.
evidence whatsoever that there's any form of malignancy or cancer.
But even when a woman does have cancer, nowadays her breast would not usually be removed. Current practice is to remove only the cancerous lump and then to use radiotherapy to kill any remaining cancer cells near it. The recurrence rate is about the same as for breast removal, and most women prefer the modern method. But this alternative to radical surgery can carry risks of its own. Janet Osborne had radiotherapy to save her breast. Now it's terribly deformed.
My husband described it as like a piece of meat that you put in the oven and you've overcooked it. It shrunk right up to nothing. They suggested that I can have my stomach. Luckily, I've had 3 children, so I've got quite a bit of tummy here. And my stomach sort of cut out, turned round and put there, and then sort of spread across there somehow. You've got to load the truck up tonight. I feel really ugly. My husband says he doesn't mind, it doesn't make any difference, but I feel really ugly when I get into bed. I would prefer to have had the breast amputated. They should have told me it was going to happen, or it could have happened. They should have told me that there are people who end up with deformed bodies like mine. But I wasn't told anything like that at all.
Jan Millington runs a campaigning group for sufferers called RAGE. Her hand's paralysed and her arm moves with difficulty. She's received more than 1,000 letters from women who believe they were damaged. Withered arms, radiation burns, paralysis, amputations.
At the moment, I get possibly daily 25, 30, 40 letters from sufferers, people who have heard of our group and who are absolutely desperate to make contact with other sufferers.
This month, her group packed a hall for their first ever public meeting. They want action. They're demanding a public inquiry into how their injuries were caused, and they say that women going for radiotherapy treatment now are still at risk. I raised that fear with Jill Bullimore, Dean of the Royal College of Radiologists.
The kind of injuries that have occurred in this unfortunate group of women, I believe, were all caused by the non-modern treatment of breast cancer.
So, what exactly do you mean by the non-modern treatment?
Treated in excess of 10 years ago, some of them as long as 20 years ago,
we've seen
when
cases,
the types of treatment were quite different to what we use now.
But we have seen cases who say that they were having their treatment as recently as 1991.
Well, I cannot comment on that because I haven't got the details.
On behalf of the big story, RAGE analysed 375 of their complaints. 137, more than a third, were treated after 1988. The women's single biggest criticism is that radiotherapists didn't warn them of possible serious side effects.
He even suggested that I should carry on work during the treatment. He said I may feel slightly sore, slightly sunburned. I may feel nauseated. But not to worry, all these effects will be temporary and they'd wear off quite quickly.
The girls said to me, you will get a bit of a tingling and you will get a hardness. But the reason we're doing it is so it doesn't spread to the others. 2 or 3 years' time, it could spread to the other breast, and, you know, that's why we're doing it.
I'm angry that I've ended up like I am without possibly being told that this could happen.
Because this subject concerns so many women, we've carried out over the past 2 days a special up-to-the-minute big story survey of all 54 radiotherapy centres in the country. We wanted to find out how they treat their patients both physically and emotionally. So the first question we asked was, what warnings about the possible serious side effects of radiotherapy are given to breast cancer patients? By 2 o'clock today, 38 of the 54 hospitals had replied. 2 hospitals, Exeter and North Staffordshire, said they were too busy to reply. Both have had well-publicised problems in the past with their radiotherapy practices. Most hospitals said they issue leaflets warning of possible side effects. These include tiredness, irritability of the skin, depression and difficulty in swallowing. Essex County Hospital and London's Royal Free refer to possible shortness of breath. But only the Royal Free, Royal Berkshire and Poole General give written warnings of possible impairment to arm movement. However, it's well established in medical literature that a small proportion of women will suffer serious effects.
Are you also going to set up a system whereby your radiologists who are practicing in the field are going to start issuing warnings to women who undergo this kind of treatment that there may be some very, very horrible side effects?
I don't think we should. Now, you want to say, why shouldn't you?
Exactly.
Because when you're going to give a patient informed consent about side effects of treatment, where do you draw the line? Do you draw the line if the risk of damage is 1 in 100, 1 in 1,000, 1 in 10,000, 1 in 100,000? Now, we believe, again, we've got, you might say, get the evidence for it, but we believe that this degree of damage occurs in considerably less than 1% of the total of patients.
Jackie Ford had radiotherapy for breast cancer. Sometime after having her treatment, she became very ill. She didn't understand why. One arm withered, and then doctors said her lungs were shrinking.
Physically, I'm able to do very little. I need help with dressing. I need help with bathing. I need help in almost every area of my life. My husband does the cooking. It's affected our lives dramatically. The pain is there all the time. You feel as though you have a slab of concrete inside your chest. That's the only way I can describe it, as though when the pain becomes severe, it's like a steel band. The chest physician said that your lung is shrinking, and I assumed from that it was radiotherapy. Nobody actually ever told me. I submitted a claim to my insurers. I said that I'd had an accident which I thought was due to radiotherapy. They eventually, of course, wrote to the hospital to get a medical report.
The insurer's medical report confirmed her fears. It said she does have ongoing disability due to the radiation changes in the left lung and chest wall.
It was stated that I was suffering a well-recognised complication of radiotherapy. But as I've said, at no stage did anybody ever tell me that. That was the first I knew.
RAGE campaigners have found that hospitals may not even know they've had cases.
We've had quite a number of hospitals contact us, asking us what the incidence is of injury for them at their particular hospital. Now, this obviously surprises us because we would have thought that hospitals would have been aware of what was going on within their own buildings. They're coming to us and saying, we're very worried. Is our treatment schedule causing difficulties? Are there women who've come forward who've been treated at our hospital?
Isn't it the kind of information that the Royal College of Radiologists should have?
How can we get it? We don't
well, you're
have...
treating these patients.
We do not have a system as yet for collecting the necessary medical data and the data on outcome that is necessary.
The Royal College of Radiologists is now designing a system for doctors to monitor the progress of all future breast cancer patients. But for those suffering now, the urgent need is to find out what went wrong in their cases. As yet, nobody knows for sure. One clue experts are examining is the level of radiation dose given in each treatment session.
Many centres are forced to treat in a relatively short period, for instance 3 weeks, simply because they haven't got the availability of equipment which would allow them to treat patients over a longer period. However, having said that, I think that most centres throughout the country, and indeed across the Western world, would regard 6 weeks, the elongated or prolonged treatment, if you like, as the gold standard, and that's certainly what we try and adhere to here at the Middlesex Hospital.
In London, we predominantly use a low individual dose over a long period of time, and experience has shown, both in this country and the United States, that this way of doing things reduces skin damage and other complications. There's no doubt that by trying to cut the number of treatments down, one increases the chance of getting the nerve injury and other problems in breast cancer.
Some recent medical papers confirm the view that higher doses over a shorter period can cause more injury. When Jackie Lukes discovered she had breast cancer, she investigated the local treatment on offer. She discovered her local hospital in Hull offered the shorter course.
My question was, why was it that a friend of mine who had just had surgery, the same surgery for the same kind of breast cancer, had had 6 weeks radiotherapy? And he said, was that London? It was. And then he said, there's a north-south difference.
The radiotherapist she talked to was Dr. Clive Preston. He gives a widely used course of 260 centigrays, as they're called, in a session. Like many doctors in Britain, he's convinced that's safe.
There may be some slight difference in final cosmetic results. They may only be small. There have been, as far as I'm aware, there have not been any major studies looking into that aspect or into other aspects of side effects of the treatment. I think if one particular treatment had over the years, one particular fractionation schedule, been found to be much better than all the rest, or have been found to be much worse than all the rest, then either one would have been adopted universally or one would have been dropped universally. That has not been the case.
Then he said, he added, we couldn't possibly do 6 weeks, we've far too many patients.
That would have revenue implications. We would require more machine time, we would require more staffing of those machines. And yes, that ultimately would require more money being spent. But at the moment, that is a future development that might occur if it was shown that a longer course of fractionation is what we should be doing. At the moment, we are happy with our course of treatment. There are no problems in terms of the resources. And certainly, even if I was offered all the machinery that I wanted today and all the staffing, I would not change the fractionation tomorrow.
Jackie Lukes opted for surgery despite the reassurances in Hull, but some other Northern Hospital doctors are switching to lower doses over a longer period. This remarkable woman's campaign may have helped influence some doctors. When she was injured by radiotherapy, Lady Audrey Ironside fought back.
My arm is so wasted now, there is very little muscle left, and it's dropping out of the shoulder socket, which is extremely painful. I was repeatedly assured there were no permanent or consequence or side effects of this treatment, and I am left in severe, constant pain for the rest of my life, and my arm is nearly useless.
Lady Audrey in happier days. She was so angry about her injuries she decided to sue the hospital.
It cost me nearly £100,000, and I just couldn't risk paying having to pay the defence costs as well.
Lady Audrey had to drop her case against the Royal Marsden Hospital, which treated her, but she may well have helped influence the hospital's dosing policy. The Royal Marsden wouldn't give us a filmed interview, but doctors there told us that in around 1988, when Lady Audrey took legal action, the hospital rethought its treatment of women with breast cancer. Lady Audrey had received doses of 340 centigrays. Now, most women receive a maximum of 200 centigrays. 4 years ago, the Royal College of Radiologists did a survey and found there were 51 different treatment methods in the country. There were some dramatic differences. Doses ranged from 133 to 583 centigrays.
What these 50 different treatment schedules show is that some people are using low doses of radiotherapy, some people are using high doses of radiotherapy, and they're using very different fractions, that is the way in which the treatment is broken down into individual treatments. These differ across the country. Now, they can't all be right.
There seems to be a remarkable difference in the treatment meted out by different hospitals. It's terribly confusing for people.
Yes, I think it is confusing for patients, but, you know, there's no single way of treating any disease in medicine, let alone in cancer. But I think that there is a general convergence and agreement on how patients with early breast cancer should be treated now.
But some of the Royal College's members don't agree with their dean.
We've got over 50 different treatment schedules. They can't possibly all be right. We can see that some may be related to problems with serious side effects. I think in the 90s, the medical profession owe these women and those that are to come along in future to try and get this problem sorted out once and for all.
In our special survey, we asked the country's 54 radiotherapy centres for details of their treatment programmes, in particular what doses they give and over how long a period. Out of the 38 who replied, 28 are now using lower doses of between 200 and 225 centigrays over about 5 weeks. But there are substantial exceptions. Wolverhampton went up to 300, Guildford 320 and Norwich 350.
Just want to explain to you that there's no reason to be nervous. What we're going to be doing today is just like having a normal X-ray.
In the United States, the norm is no more than 200 centigrays a session.
The optimal doses tend to be between 180 and 200 centigrade. This dose, we have found, leads to optimal cosmetic results in the breast, good tissue tolerance in the lung, skin, and other adjacent tissues.
Dr. Brown would never use the higher levels found in some British hospitals.
If doses of as high as 280 centigrade were being used per day, I would expect normal tissues to react very poorly with scarring, with other types of bad effect, and that the goal that you're looking for, that of good cosmetic result, that of function, that of preserving the breast, may be lost.
But some doctors believe that problems are most likely to arise when there's a combination of higher doses and poor technical skills.
When we irradiate the breast, what we do is use several fields, one from this side, the other from this side, and yet another if we irradiate the lymph nodes under the arm. Now the problem is where the fields come together, there's a danger of overlap, that is increased radiation dose. The reason that some hospitals are avoiding overlap is their technique is better, others the technique is sloppy.
I don't think there has been sufficient research into this question of side effects following radiotherapy, and in particular, we need to know for sure that there appears to be a real difference in terms of likelihood of injury between departments that use different techniques, because the technique is clearly critical.
Because of the RAGE campaign, many women in Britain going for breast screening now feel uncertain. The fear is that they could be put off going for checkups. And the worries over breast radiotherapy come in the wake of the massive underdosing of general cancer patients in North Staffordshire. A government report will be issued on that next week. And yesterday, 17 Manchester women who were treated for cervical cancer at the Christie Hospital were granted legal aid in their action over alleged radiation overdoses. It's a critical period for radiotherapists.
Can you confidently put your hand on your heart now and say that you are certain that nothing like this could ever happen again?
I think ever is a very long time, but I would say that I have complete confidence that patients treated for early breast cancer with radiotherapy have nothing to fear about their treatment.
There must now be an independent inquiry, and I mean out in the open, not behind closed doors with closed minds. It's been swept under the carpet for long enough. This has got to come out into the open.
The incidence of this severe injury is difficult to ascertain. The highest published series is around 6%, but almost certainly the RAGE women have uncovered much higher incidence in certain places. And what we need to do is get the study complete to sort out where they are and what can be done about it.
I do not want to defend the use of a treatment that has caused such terrible damage in these patients. My own practice has had to change. Now, I think I will have to say something about it, though I'm not terribly happy about it, because a lot of women's lives will be made much more miserable by that knowledge, and I guess that very few, if any of them, judging by my past performance, so to speak, will develop this particular injury. So I think it's not an easy issue to resolve.
What RAGE wants is an open public inquiry into the whole issue of radiotherapy in the treatment of breast cancer. They want the history and they want the present techniques involved in radiotherapy of the breast to be properly examined.